So today's question is a two-part question. The first question is, how do I know if I have chronic Lyme? So I guess the first thing to think about is the definition of something that's chronic is something that has been present for several months or more. In the medical world, we think about 6 months as the length of time that it takes for something to be considered a chronic disease or chronic illness or infection. And in order for someone to develop a chronic infection, they first need to have had an acute infection. So if someone has had an acute case of Lyme disease, then you already know that you're at risk for developing chronic Lyme disease. The studies that we have shown about 20% of individuals that develop acute Lyme disease develop chronic Lyme disease. So that's a fair number, 1 in 5 to be exact. And then we have the group of people who don't remember having this acute disease, like the acute illness part of Lyme disease here. And I would have to say that probably the vast majority of people that are asking this question are the ones that are in that case, where they don't even know if they've ever had Lyme disease in the past. In fact, many people have Lyme disease that is undiagnosed for many years. And in those cases, I think it's important to turn over to the ILADS Guidelines, ILADS being the International Lyme and Associated Disease Society, that is a big proponent for the treatment and recognition of chronic Lyme disease. So what they say is that, first off, if someone has chronic symptoms that either has not been diagnosed or has not had an acute case of Lyme that we know, they recommend looking at other possible sources first. And I think that's important. In fact, my own personal opinion is that it might be smart to kind of look at those areas simultaneously, actually, because sometimes we have a lot of people that have been doctoring for years and years and years before they come to us and then are diagnosed with chronic Lyme disease. So I think that it definitely makes sense to be looking at all the other possibilities that could be causing these chronic symptoms, but at the same time, looking into chronic Lyme disease. So the vast majority of patients we see, again, are the people who don't remember having an acute infection, but have had chronic symptoms, chronic joint pains, headaches, brain fog, fatigue, difficulty sleeping, neurologic symptoms, pain, mood changes, all kinds of different things that are classic for Lyme disease. And these are symptoms that have been going on for quite a long time. And there's no answer that has been found to really pinpoint what the underlying cause is. A lot of people are going through symptomatic treatments or have been diagnosed with things like fibromyalgia, or seronegative rheumatoid arthritis is a common one we see, which basically means that the patient is thought to have rheumatoid arthritis, but the blood tests have all come back negative. So when we have a case like that, automatically the flags go up in my head and I start thinking about chronic Lyme disease. So that's the first thing. Either you've had an acute case of Lyme disease and you've developed chronic symptoms, or if you don't remember that acute case, but you have chronic symptoms, that there seems to be no other really good explanation as to why they're there. So secondly, what we do then is we do testing. We do lab testing to confirm whether or not Lyme is present. Lab testing is not perfect, and I've done other videos that have talked about that, and we could go into that in more depth, but lab testing is still a crucial part of the diagnosis and recognition of Lyme disease, especially when we see someone who has what we call IgG antibodies, which are the antibodies that show up in a chronic infection or a latent infection, something that's been there for a while. The other thing that we always look at is we look at whether or not there are some co-infections present, things like anaplasmosis, babesiosis, ehrlichiosis, Bartonella. Those are things that we see very commonly with someone with chronic Lyme. And I've had a number of cases who have come back positive for co-infections, but negative for Lyme. And I think that in those cases, it's very likely that Lyme is also a player too. A negative Lyme test cannot rule out Lyme completely, especially when we've got the clinical picture that fits and we've got co-infections that are positive. It also is important because those co-infections can be a big part of the underlying and overall health of the individual. So very important to remember that chronic Lyme is usually not just referring to Lyme disease alone, but it also refers to these other co-infections that go along with it. So the short answer is an acute case that's gone chronic, or a chronic case of symptoms that have no other good explanation for it, that show some possible positive evidence on lab tests. There are cases, of course, too, that will come back with inconclusive results on labs or negative labs when we know or have a suspicion that this is Lyme disease. There was a case that I had a few years back where this particular individual had an acute case of Lyme. We knew that was very clear. They were treated for it, but they developed chronic symptoms. We did a test at that time, and the lab tests all came back completely negative. There was no trace of any antibodies that we could see. In this particular case, I remember talking with the patient and telling them that, the chances are really good that you've got chronic Lyme, and I would recommend that we move forward with treatment, which the patient agreed with, but they still wanted to do more testing. So we ended up doing a more expansive test that covered multiple different strains of Lyme. We did it through IGeneX out in California. And this particular patient actually came back positive for a relatively rarer strain of Lyme. So he had Lyme. We knew he had Lyme, but the testing didn't show it. So clinically, that's very important. We need to look at not only the lab test, but the clinical picture as well. So I hope that helps answer that question. Whether or not someone has chronic Lyme, there's a lot of factors that we look at with that, but most importantly is what do things look like clinically, and can we find any laboratory evidence to support that? The second part of that question is more for those who have chronic Lyme, and the question is, what can I do when I have a flare-up of my chronic Lyme symptoms? So I think first thing to remember is that with chronic Lyme, if we're having a flare-up of symptoms, it's a little more of a complicated question to answer too. I would have to say that number one, I'd have to be asking ourselves, are we treating? Are we treating for chronic Lyme? Are we doing anything to help kill the bacteria that's still there? Because if we aren't, then that's probably definitely something we need to be doing right now. In those cases where it seems like symptoms get better and they just keep coming back, getting better, coming back, and we're starting to question whether or not we're actually killing the bacteria, is there still bacteria present? Is this more of a chronic inflammatory response or autoimmune response? Which, to be honest, we don't fully know which one of those three, if not all three of those things, are players in those chronic Lyme cases. My suspicion is that there's definitely multiple factors here as well. So I always tell patients, number one, we treat infection. Number two, we treat inflammation. Number three, we treat the immune system. And if we're doing those things, looking at all the factors that could be affecting those things, then we're going to have a better outcome. In the short run, if someone's having a flare-up of Lyme symptoms, there are a number of things that you can do to try to help calm it down more quickly. If it's just that the Lyme symptoms have flared back up, there's plenty of options to treat pain. There are options that we can use to help with inflammation. We can use things like PEMF, pulsed electromagnetic field therapy for inflammation. We can use hyperbaric oxygen therapy to help with the immune function. We can look at how are we sleeping and try to help in that regard. Are we able to get you sleeping better? We can use medications like low-dose naltrexone to help with inflammation. So there are a number of things that can be done with an acute flare-up. Infrared saunas would be another one to think about here too. There's a lot of those types of treatments out there that help. But looking at those three aspects, inflammation, immune function, and infection. And if we're going after those three things and really being as diligent as we can, I think that's how we really need to manage those flare-ups. And recognize that a flare-up is probably a symptom of the underlying issue. And that if all we do is treat the flare-up, the chances are good that flare-ups are going to come back. I know that sometimes it's tough, and sometimes it feels like that's the only thing we can do. But I always try to look at every option and really dig through a patient's case to see what is it that we've tried. I had a provider once tell me when I started training with Lyme that you really got to be open-minded about the different treatment options because people respond to different things. And I found that to be very wise. That counsel was very wise, and has been helpful for me in my practice. And so again, if you think you've done it all, and you visited with doctors, I would just encourage you to keep looking. There's answers out there, and I think that we're going to find more answers through the scientific research that's being done as well. And so hopefully these help answer some of those questions for you. This is our second in a series of Q&As that we're planning on doing here. And if you have other questions, please leave them in the comments down below. Comment on our Facebook page. We would love to hear from you. And the questions that you have, the more questions you have, the better it is for me, so I can answer what you want to know. I've also had some interest in doing a live Q&A event here coming up, and I think we're going to plan on doing that sometime in the near future here. My schedule is pretty busy for the next month or so, but coming up here in March, I'm hoping we can do that, and just really get you all together to bounce some thoughts off and answer questions that you have.